We are recording.
Okay, so I have to read this whole thing, right?
Yes.
Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, chapter 3818, and the governors for people that may gather in one place. This meeting of the Board of Health will be conducted via remote participants as possible. Specific information in the general for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the Office of the AG web page. No in-person attendance of the meetings of the public will be permitted. The town will persevere to use conference call capabilities regularly for other parties to listen in and participate accordingly. If not possible, on the town's website, an audio recording as soon as possible after the meeting, and this meeting is being recorded. Hi, everyone. Hi,
Hello.
Mackenzie.
Hi, nice to meet you.
Are you sworn in?
I am, yes.
You are. Okay, so just want to welcome you to the board. Welcome.
Thank you.
I don't know if you've we introduce ourselves. I'm Sue Broska. I've been on and off the board since 1981. Jean, you want to say a little bit about yourself?
I'm wearing my
Are you
pajamas.
with us, Jean?
Yes, I am
Okay.
wearing my pajamas.
You want to say? Okay.
I've been secretary to the board since 1980 something, and a member for the last 6 years.
I did not know that
And you're also,
Jean was working with the board. That's the first time you guys should have done this for me when I started.
Oh, sorry.
yes, she's been with the board a very long
Wow.
time. Also, presently you're with conservation. Right?
Yes, I'm the secretary to the Conservation Commission, the Sewer Implementation Committee, the Agricultural Committee, and I have a full-time job. And I have a husband that I have to clean up after.
Full-time job.
Which is another full-time job.
And
And Jessica
one time-
Polly,
you were secretary.
huh?
Pardon?
I was going to
One time you were
introduce,
secretary to what? To the planning board.
I was, before I became secretary to the Board of Health and something.
Yes, I stole
It's been a while.
you. I stole you away.
Yes, you stole me away.
We
Jessica,
also have. Oh, you want to? Yeah, I was going to say Jessica.
Here I
Your
am.
turn.
Hello. I cannot tell you how long I have been part-time secretary because I don't remember, but it's been a few years. I only work part-time, so I'm not in every day. If you need something from me quickly, your best bet is to text me on my cell phone. And nice to meet you.
Nice to meet you.
Jessica, how many
Yeah.
hours do you usually work in person? How many hours are you
usually
in person
about-
down at the town hall?
I'm usually there about 5 hours a week, unless it's late fall, early winter, and then I'm there quite a bit more doing all the permits. Not all the permits.
Then we
But a
have
lot
Kate
of
Johnson. We have Kate Johnson. Okay, we have Kate Johnson, our health nurse. Actually, will be leaving us, but Kate, are you there? You want to talk a little bit about how long you've been with us and what you do? No. Okay.
I'm
Tammy.
sorry. Okay, I'm here.
Oh, okay. So
Yes, of
Did you hear
course.
what I asked?
Yes, I did.
Okay, so go ahead.
Okay, so my name is Kate Johnson. I've been the public health nurse for the town for 13 years. Loved my job. It's been very fulfilling in terms of community education and disease management. Certainly, the pandemic has been an unbelievable experience, I must say. But again, it's all about learning and reaching out to the community. I mean, I never would have met and spoken with so many people in the community, probably 500 residents or so, maybe more. And I just decided to retire at the end of June to try to, open up a window and opportunity for someone else to take the position over. And I do that, with a lot of love and gratefulness from the community. So it's been a blessing to me. It really has.
Awesome. Nice to meet you.
Okay. Tammy, your turn.
My turn. I'm Tammy. I'm the health director. I have been in public health now in September, it'll be 20 years. But I have only been in this position since about 10 weeks before the pandemic started, since the beginning of last year. And it has been, it's been the most stressful year, but it has been the most rewarding year of any of my career. Just amazing. The board has been great. Kate has been an awesome and true ally throughout all this craziness. I'm so sad to see her go. Jess, I've put her through heck mailing out stuff to our businesses almost every week when the governor changes the orders. It's been, and our illustrious select board members, they know when I need something, I bug the heck out of them too. But it's been great.
Awesome. Nice to meet you officially.
And
So Mackenzie, we also have Doug Moblin. Doug Moblin will Zoom into our meetings, and sometimes Joe Didi, our two selectmen. I don't know if you've met them.
Yep, I have. I'm familiar with both of them. Yep.
Okay. And then Peter Courier from the paper has been coming to our meetings too. Let's see. We're going to need your contact information, your address, your email, your cell phone, your home phone. And I don't know if it's easier to get it to Tammy, and Tammy will get it to Jess, or to Jess.
I've got some of her stuff. So if you want, if you can email it to me, and then Jess will make the slip and our contact stuff and redo it and hand it to us.
Yeah, I can absolutely do. Sorry, those are my dogs barking. Sorry. But yeah, I can email you with all my contact information if you can disseminate that information.
Perfect.
Okay. So Jess will put it all together. Jess, you have what I sent you last night, right? Or the night before?
Yes. Yep, I have it.
You can just add Mackenzie's to it. Okay,
Yep.
so Mackenzie, tell us a little bit about yourself.
All right, awesome. So I've been a nurse for about 6 years now. I'm gonna move on the fly here so we're not in my family room. So I started off in the ER. I've been in the ER for a couple of years. I love that. So throughout this whole pandemic, I can tell you that it's been definitely the most challenging of my career, but it's also been very rewarding. Seeing these patients come in more dead than alive, and kind of bringing them back and getting involved with their families, and kind of, educating not only them, but their families of, how to protect themselves and keep themselves well during this pandemic. So it has been definitely very rewarding. I also just recently started teaching for Elms College. So I'm teaching their nursing students. So I'm building up the new generation of hopefully superstar nurses. And I love that. I'm very passionate about teaching them. I just had a daughter. She's 6 months, and then I have a 10-year-old stepdaughter with my husband. We've lived in Southwick pretty much our whole lives. Grew up here. So that's why I kind of feel like this was a great fit in a time in my life where, you know, I'm starting to get really involved in our town politics, and I'm genuinely concerned. You know, I want my daughters to grow up in a town that's successful and thriving, you know, instead of the opposite, I suppose. So I'm really excited to be here.
Good.
Mackenzie, what hospital do you work at?
I work for Bay State Noble in Westfield.
Oh, okay. I'm the chemistry supervisor at Noble.
You are? Have we ever met?
Yeah, in the lab there. Probably not, because I pretty much stay in my suite there in the lab.
Oh, okay, that's awesome.
So right now, are you in the emergency room?
Yeah, yep.
What shift are you?
Well, I went per diem after I had my daughter, so I kind of just pop in and out. But I was days for years.
Okay. Okay, I'm days. All right, and I do have a bad connection, so I might be going in and out.
Yeah, it's kind of spotty. I can
Okay,
really
so
never
the
hear
Board
you.
of Health, yes, the Board of Health, pre-pandemic, and we're basically, I don't know, and Jean, you can correct me on this. What do you want to say about 60% septic, perk tests, repairs, inspections, about maybe 20% restaurant inspections, complaints, and new restaurants coming in. Maybe about 15% housing, tenant landlord types of things, and then maybe about 5% nuisance, infectious disease. We have very little infectious disease pre-pandemic.
Mm-hmm.
We meet the first and third Thursdays of the month, generally, depending upon, but there are times where we'll meet other days if the first and third aren't good, or if something's going on in town sooner.
Okay.
And I think that's about it. Jean, did I forget anything?
We used to only meet once a month during the summer. I don't know if that's going to continue in that.
Guess we'll have to see, play it by ear. And we met, you know, in person, obviously, down at the, you know, is that called the land use room? No,
No,
I thought there
that
was.
little room, what's a little room called?
One's the land use conference room, and then the other one's land use.
the big room is the land use room, and the room that we meet in is land use conference.
Conference. Oh, okay.
And that's the room, that's the room right across from the Board of Health office. Tammy's also, you're involved in committees and stuff like that, right?
Oh yeah, LEPC.
Did you mention any of that to Mackenzie?
No, not yet. No. I think the LEPC is the only one I'm really officially sworn into for the town. And that meets
What
the local
what
emergency planning
tell her what that stands for.
committee. So that is more of an all hazards committee. So it wouldn't necessarily be, it wouldn't be coronavirus. It would be more like hazardous materials, like tanker truck rolls over, that sort of thing.
Right.
And then any of the businesses in town that might pose a hazard risk would be involved with it too. Albeit we have used it as a platform over the last year to kind of update each other on the virus and kind of see what sources we need. And because PPE was a real big problem early on. now it seems everybody's sort of inundated with it, but
Yeah.
now it's kind of not as much of a big problem. But that was one of the things that we were working on so much in the beginning, was just trying to make sure that the officers and the fire department had enough to just do their basic job instead of reusing. I'm sure you were very familiar with it, with being at the hospital.
Yeah.
That was hard.
Yeah, it was not good. In the beginning, we didn't even have PPE, so we were good to use the same N95 for 3 weeks in a row, you know. Yeah.
I'm supposed to pick up, like, I don't even know how much PPE and hand sanitizer from Palmer sometime soon, because they're like sending, like, I think 14 pallets.
Yeah, it was really unfortunate because a lot of people donated PPE to the hospital, but unfortunately it didn't meet up to their standards, so we couldn't accept it. So all these people were trying to do, you know, their part, but we had to turn them away. And it's like, you know, I have an N95 mask that's a month old in a brown paper bag, and we can't accept it because it doesn't.
I'm gonna try to mute Jess. There we go.
Okay.
Sorry.
Yeah, so we felt the pain of the PPE too, definitely in the hospital.
I'm
Okay,
I head up the safety committee.
so
That
what?
I had the town safety committee. I didn't even, which we have not met.
Think of that. Okay, so any questions you have of us, Mackenzie?
No, not at the present moment, but I won't hesitate to ask if something comes up.
Okay. Approval of minutes. Did you read them, Jean?
Yes, I did, but prior to that, I need to make a motion to appoint Sue Broski as chairman of the Board of Health, so we can elect our officers.
Okay, I think
I
I have to
second that.
tell Mackenzie how it all works.
And Mackenzie just seconded.
That, all right.
Yep, I second that.
All in favor?
Aye.
Aye.
I think for the purposes of Zoom, you do have to say your name.
Yeah,
the
yeah,
call,
that's
and
true.
then say-
Yeah, well, Sue, when you call for a vote like that, when you ask for a roll call vote, you say the name and then the person
Mhm.
says aye or nay. So if you want to do it that way, or the vote is call for a roll call vote, and each member has to identify themselves and say a yay or nay.
Okay, roll call vote. Okay, Mackenzie,
Yay.
Jean,
Yes.
and I'm I'll vote too, even doing it against my be chairman, but I will be.
Yay.
So, okay. All right.
And yes,
The
I did
minutes,
read the
Jean, did you get
minutes.
to read them?
Yes, I did. I didn't see any much.
How about Mort Vining? Is there a Mort Vining Hill now, or
It's Mort Vining Road.
Mart Vining Road and then Vining Hill Road.
Oh, what did I write?
Oh, I didn't even
under
see that.
Title V, first sentence?
Got it. Yeah, I don't know why I did that. Sorry.
It's Mart Vining.
It's Mort Vining. I just double checked. And I don't know what happened to my audio before. I think it connected to the car, so I apologize on that whole thing.
It sounded like kids screaming. That was it.
Oh my God, because my daughter left to bring someone somewhere and my Bluetooth was on. So sorry about that.
Right, there was something else too. I don't know. There was a period missing. Do you remember seeing anything, Jean?
No, I didn't. I didn't even pick up on the
Okay,
Mort
well-
Vining.
All right. Well, if there's anything else, then it's probably just really minor little things. I should have printed it out and marked it, but I didn't. But yeah, thank you, Jess. Very good. So do I have a motion now? Can Mackenzie vote for these minutes, even though she wasn't
She has to
a
abstain.
member then?
She can abstain, but I believe she still can vote. So I will make a motion to accept the minutes.
I second it. All in favor? Sue, yes.
Jean, yes,
Mackenzie, yes.
or abstain.
I think she has to abstain because she wasn't at the meeting.
Yeah, so
Right.
I think so too. I
Abstain.
don't think I'm allowed to vote on them. Okay,
Okay.
Mackenzie
it
abstained.
wasn't.
Okay.
Okay. All right, public comment. Peter. Do you have anything?
Yeah, I have a question for Tammy for a story we're working on, if you don't mind. I just don't worry, nothing super nothing super difficult, I don't think. Just with the May 29th announcement from Governor Baker, I was just wondering if I could get your thoughts on if you think now is the right time for that kind of thing, or if it was too early, too late, should have happened a month ago. Just your
Peter,
general thoughts on that.
can we wait for those types of questions until we actually get into the COVID section of the meeting?
Yes, of course.
Okay, Tammy, is that okay with you, Sue? Is that okay with you?
Yeah, that's
I'm-
fine.
We'll talk about it at great length.
Okay, I figured as much, but I had to ask anyway.
Doug, you got anything you want to say now?
No, I'm good right now. I just wanted to welcome Mackenzie to the board and congratulations to you as chair.
Thank you very much.
Do you have anything you want to say now?
Was that for
Am
Joe?
I not?
No,
Yeah, am I breaking up?
yes.
Okay.
A little bit.
Which brings
I'm
me to
breaking up,
one, yeah,
Joe.
which brings me to one point prior to
Sorry.
the meeting continuing. As you walk into town hall, there's this sign that says face masks must be worn into this building as of March 24th, 2020. Is that true or not?
The order is in place until May 29th.
Okay, so why
There
are
is an
some,
order.
why are some not?
For inside of buildings,
Yeah.
the May 29th order is in place.
Okay,
Yeah.
so why do you go into town hall and into town hall offices and people aren't wearing masks?
Because the office workplace standards, that in your own workplace that's not open to the public, you are allowed, if you have 6 feet of coverage, to take your mask off at your desk.
Okay, so walking down the hallway without a mask on is not acceptable.
You're supposed to wear them.
Okay. Okay, I won't interrupt the meeting anymore. Go ahead.
Okay, Tammy, your report.
Okay, Jess, start right. I'm just joking.
Interrupt.
I always make a copy for Jess so
You
that.
can interrupt all you want, Jean.
All right, so this was a very heavy perk week. So if anybody saw me in the building this week, you were really lucky. Let's see. I did perk test for repairs at 18 Pineywood and 49 Tannery Road. And I did perk tests for new lots. Lot 11 Noble Steed, lot 12 Noble Steed, lot 13 Noble Steed, and lot 17 Noble Steed, as well as lot 2 Mort Binding Road, 3 Mort Binding, and lot 7 Mort Binding. And so perk tests, I'm not sure where you are in town, Mackenzie. It's a soil evaluation, so we go to the spot and they dig a bunch of holes and basically watch water go down a hole to put a value on the soils so that they can size up the septic field a certain way. They can
Yep,
take,
I'm familiar.
yeah, they can take an hour, or like today, some of them took 3 hours. So it's,
What
like-
are the soils like at the greens?
the greens that they are pretty sandy. They're a little, they're the green. Well, I wasn't at the greens at all this week.
Oh,
I was
I'm
at
sorry.
no, I was at Noble Steed.
Noble Steed, I'm sorry.
Yeah. The
Noble
front
Steed.
half of Noble Steed is like a beach and it doesn't have water. The back half, there's that wetland,
Mm,
and the back half is very saturated, more like a loamy sand, and there was a lot of water. So that took all afternoon. Definitely. Same thing, Mort Vining. Mort Vining was long. I'm glad I had 90 SPF on, which is a real thing. Carl was like,
Would
didn't
you
believe.
notice, yeah,
Oh, man.
Tammy, to the College Highway going west, the soils are usually tougher than going east. I don't know if you've noticed that yet.
College Highway going
Going towards Springfield, that area there,
College Highway going
that's east.
Westfield
that's easy.
is super sandy.
Going east, yes, going east, going
Feeding Hills
west,
Road
soils are tougher.
on
No, west meaning up Granville Road,
oh, that you mean up that way? Yes.
where Gene,
Yeah. The further you get away from
where Gene and I live.
yeah, the further you get up away from College Highway, the worse they are. Definitely. But if they
Hey, also, title, for Mackenzie's sake, Title V, can that be accessed online? If she wanted to just review to see what Perk Tests and Title V is all about?
oh yeah, I a couple months ago, if you go on to the health department's webpage, I had a tab that's Septic and Title V, and it has a link to the website, has a link to all of our forms and things like that and checklists. So it
Okay,
makes
awesome.
Yeah.
Does it have a link? Does it have a link to the actual Title V?
it does. Yep, it does.
It has a link to the actual title. Okay. You also have links on there for the restaurants and the housing.
No,
Is that a
got
yes
a page. I don't have a page for that.
or no?
Hey, actually, you know what? I think
Okay.
there is one. It's an older page. I think Tom had that up there. Oh, now I'm gonna have to review if it's still up there.
For
Did a lot of changes for me.
for the housing or for the housing or
For the other
for
for the other
restaurant?
codes. I'm gonna have to see. I thought it was up there, but now that you're saying that, I gotta take a look. I think so.
Okay.
Yeah, because there's tobacco.
All right, just so Mackenzie, if she wants just a little background.
But I don't know if I've even tried the links lately, so maybe I'll make sure Jim takes a look and tries the links to see if they're still valid.
Okay. All right, go ahead.
Okay.
Sorry.
I did two final inspections for septics, both repairs, 158 South Long Yard and 30 Woodland Ridge. Approved septic plans for 24 Deer Run. That's a new one. And the rest are all repairs, 22 Laurel Ridge, 158 South Long Yard, and 102 Mort Vining. Did food service inspections with Mac and Sliders and the Cinnamon Bun Saloon. I had one housing.
Where's that?
They're in front
Tammy,
of
where's that?
Coward Farms. In front of Coward Farms.
Oh, okay, I saw that.
Yep.
Yeah.
I did a housing inspection at Lakeview Apartments for ants. And I was called in by the police to go to an apartment at the cottages for mice. But it did not. It was more, it ended up being a well check call.
Did you find ants?
At the Lakeview Apartments, yes.
And what are you doing?
I gave them an order to correct, and they need to have a professional come in. It definitely would, it's not something they could handle on their own.
And how many days did you give him
Hey, who's
before the
on?
correction?
5/7. So either 7 days to correct or 5 days to get a contract.
And they'll send you the
Who's in
report when,
Charge of Lake,
It's a
go
association.
ahead, Jane.
I finished. You're the one breaking up. I'm fine.
Oh, I'm sorry. So who's in charge of Lakeview now? Like, who's your contact, Tammy, at Lakeview?
I don't have a
Am I
con.
breaking up again?
I've left the messages, but I don't know who the contact is. I mean, I have their contact information in their things, but I don't know who it is.
Yeah, because Marie retired.
Yeah, I have
Oh,
a
she did.
contact. So,
Right.
let's see.
Okay, so what about the mice?
It was a senior who needed other services, is what we found out. There was the cleanest little townhouse, so. But I had contacted the Council on Aging too, and so they're all aware, and the fire department, the EMTs were kind of handling it from there. Oh, and then this afternoon, I went on a complaint for a faulty septic system on Fenton.
Was that confirmed? And what are you doing? You issuing a letter to the owner?
Yeah, I have to.
How
Yeah.
many days you
Okay.
giving him to correct?
I'm gonna have to look at what I did for the last one, but I mean, they do have 5 years.
On a failed, is it surfacing?
If you look at the Title V, like they can continue to pump. I think it's for 5 years, or is ours different? We do have a town code. We do have I think it's 3. Yeah, that's for the town.
You know, our regulations have to be updated. I don't know if you've ever looked, if you looked at them.
You know, I put some notes on them, but obviously this year has been a little COVID heavy, but
We have to, those need to be updated, and the well regs need to be updated.
you think
Okay, so Fenton Drive, was it a neighbor that called? Was there a neighbor that
yeah,
called with the
Called.
complaint?
yeah,
Okay.
you could see the breakout down the hill. Definitely.
So are you gonna get records on pumping from the owner?
I'm gonna need them until they fix it.
And
Yeah.
how often?
It's
It's needed by the as recommended by the pump company.
Okay.
Yeah. Let's see. The MIHA, Massachusetts Environmental.
Hey, is there a wetland? Tammy, is there a wetland there
It doesn't
where
look
the
like it.
water's
It's up on-
running?
It's up on a hill.
No, okay,
No,
okay.
yeah, it's up on the hill. There's an odor as well. I think that was the major reason why the call was put in, was the odor. So MIHA, the Massachusetts Environmental Health Association Spring Seminar just occurred. It was actually really great. They had topics about behavioral health during COVID. So basically to tell everybody to hang in there. They went over food waste and some of the options that we have through the state. I know in the past, before Tom left, we had been talking about some of the options. So if we ever have issues with restaurants and their odors coming from their dumpsters, how to eliminate the food waste so that you can actually benefit your business, things like that. And then they did, community sanitation was there to give us sort of an outline of what it's going to look like for the summer with the camp guidelines. So they've kind of, and unlike last summer where they had these like definitive regulations for everything that goes on in the recreation camps, they've made this, it's actually, I like how they did it. So they have, there goes section by section from the code, and they put in mandatory requirements due to COVID, and then they give you sort of like recommended requirements due to COVID. So there might be some things that you think might work a little bit better for your camp than other camps. So I thought that was kind of neat that they put it out that way, and it's all easy to find on the state's website. We've had the so for meetings, we've had just the twice weekly interagency conference call with the state to the local public health has gone down to 1 time a week, which was really unfortunate because it happened the week of the governor going on and announcing the changes to the restrictions on May 29th. And of course, we all had questions. The state, they emailed us at 8 a.m. that morning, said, hey, everybody, join us at 10:30 for a webinar so that we can tell you 30 minutes before the governor goes on what's happening. So that's always, so this is a thing that everybody's always surprised when they call up the health department that I didn't have advance notice anytime a phase happens or whatever. They give us advance notice of either a day or an hour. But that's been about it for all of COVID, which we just roll with it. And that's what we've had to do. And then we also had the special town meeting and the annual town meeting this week. I think it went really well. It was a beautiful night. Everybody wore masks, even though they could have taken them off when they sat down. Just about everybody kept them on, which I thought was like really interesting to see that sort of dynamic. I thought it was great. So that's that for meetings.
What was the attendance? What was the
100?
Tammy? What was the attendance?
I think the town clerk said about 100 or so. Yeah, that's a good number.
Wow.
I think I heard 94.
94. Well, plus the 4 of us and
Hopefully Jerry was
non-voters.
there for the Board of Health.
No,
Okay. Oh, you went to good. Oh, you didn't go.
I did.
And only, oh, you did go.
Yeah.
You know, we've got to meet. We've got to meet in person. This is my connection's awful. In fact, when will we be able to meet in person?
Well, we don't know. So on June 15th, the emergency order gets lifted. So we don't know whether or not the in-person of the public will be lifted. But I know that's, so next Monday at the select board meeting, we're going to talk a little bit, right, Doug, about town hall. And I know you guys have been doing a lot to get so the larger rooms will have, okay, I'm not technical, so they will have the capability of us sort of meeting in person, but having the option for the public to Zoom in, because the pandemic is not over. It's not. So by just saying that, just because masks come off on the 29th, it doesn't mean it's over for the town. So there are people who are not going to want to be able, they're going to want to be able to participate, but they're not going to want to come in person. So I know that's been something that the town hall has been working on to get in the auditorium and then the land use room, Doug?
No, we're going to focus on getting the selectmen's conference room and the land use room done first. The auditorium is going to come later.
Okay.
I don't think they're going to be ready though for June. We'll see. So it may be a little clunky, and we're waiting to see what. I'm sorry to jump in, but we're also waiting on some potential legislation regarding remote participation under the open meeting law. 30 days after the governor's order, as I read it, we would have no choice but to have to go back to in-person every board member would have to be there. You could not have remote participation under the open meeting law. We could let the public in via Zoom. That seems like it's okay, but not for board members.
This is something you're going to discuss at your next meeting, Doug?
Yes.
Are you going to zoom into that, Tammy?
Yeah, I'm gonna zoom in. Give my input.
Jean?
And
do you
Tammy and I
want
plan to talk
zoom in
tomorrow too,
also?
as well.
What day is that meeting, Doug?
Monday.
Do you want a link just in case, Jean?
I
I've
can
got
get it
it.
off of the website. It has it on the agenda. All the Zoom meetings are on the agendas.
Carl just sent me in an email. I'll forward it on, okay?
Okay, so that's the 24th. What time does it
For
start?
it, just in case.
We start at 6.
He said to like around 6:20 to chime in. Is what,
Okay, I'll write it on my calendar.
6:40,
6:40.
6:40.
and we never run on time. But
45.
yeah, 6:40.
Do you meaning that you're late or early?
We're always late. But 6:40 is the time, the posted time.
Okay,
Now, Doug, that link you just shot over, how do you save that?
I'll email it to you too.
That's, so forget it. Tammy's gonna
Oh.
do it.
Yeah, I can send it to everybody.
Perfect, thank you.
Okay, go ahead, Tammy.
Okay,
Oh,
so
sorry.
our last thing before we go on to COVID. So we've posted the public health nurse position through the regular channels. I know that I'm not sure which the paper, I can't think of what paper we normally post in. That went out. I posted to the Mass Health Officers Association board and to Western Mass Public Health Association, and Kate was just helping me post it to the Massachusetts Public Health Nurse website as well. So hopefully we'll be seeing some interesting candidates pop up soon. That would be great, just to get somebody on board so that we can kind of get them familiar before Kate leaves. Don't leave, Kate.
You're sweet. I'll be there until you get someone new.
Let's see. So
Hey, a question. If we, Tammy. If we, when we interview, that's open to the public. Do we have to have anything, any executive session? No, Jean, right? Because we didn't with Tammy. We just have to have an interview, make our selection, do a contract. Am I correct? Just with
yeah, we had an open meeting when we voted on hiring Tammy.
Tammy.
I think,
Hey, Kate, did you ever have a Kate, did you ever have a contract?
Nope. I never did.
No.
It was just a stipulation of
Okay.
hourly wage.
All right. Okay, I guess we'll wait till we get some candidates. Go ahead, Tammy.
Can I suggest something also?
Sure.
Include an evaluation
Yes.
for that public health nurse. I've never been evaluated, and I think it's really very important that that position is evaluated.
well, up until this past year, Kate, we've only seen you like an hour or two. So
That's
There
true.
wasn't much there to evaluate.
That's true. I agree. But consider that for the future. At some level,
Yeah, that's,
to make sure, to make sure that
that's a good suggestion.
like things are happening, communication is happening, updates and the annual report and things like that. It's just good to check in with the nurse and make sure things are going well and they're serving the community as expected.
That's a good idea. We will do that.
Thank you.
I've got
Okay,
your,
Tammy.
I've got your COVID reports. Do you want me to share it so that we can talk
Yeah,
about?
sure. Yeah.
Here we go.
Oh, so pretty, right?
Bring it down a little, or bring the bottom part up a little tiny bit.
How's
I
that?
lost. Oh,
Fully
there.
vaccinated individuals is what?
What are you looking at?
That's for,
Dee?
At the little blue
15 to
portion
12 to
down
15.
bottom?
You talking about the
Here?
12 to 15-year-olds?
Yeah, no, I'm talking about fully vaccinated
total.
individuals.
Mhm.
The percentage is just like a little asterisk, not a number.
Because until this week, there was no 12 to 15-year-olds. That last reporting
Go
period,
down.
Oh, down
The
at the
total.
total, at the bottom, the total.
Exactly. So they don't have the data to support that field. Is that what that star means?
So you have a number for 16 to 19, you have a number for 20 to 29, etc. And then down at the bottom, because of there's no data for 12 to 15-year-olds, you can't total the rest of the ages.
Gotcha. Yep, that's correct.
that's how Excel works because of that.
And hopefully every week, right, those stars will change
I'm gonna
as
do the
more
math.
people.
Yeah, I'm doing it now.
It's good. So totally vaccinated, you add those up, divide it by 9,800.
Let's see, we got 3,330 fully vaccinated individuals.
Divide that by 9,800. That'll give you the percent.
34%.
That's
Okay,
sad.
so 34%.
Yeah,
I'm still I'm still confused about partially vaccinated. We
There-
really didn't know what that meant, unless it was people that didn't want to come back for the second.
I think
Correct.
we did clear that up this year, right? This week, right, Kate? At the
The same.
conference call.
Well, yeah, partially vaccinated, right? So they didn't come back for their second dose, which can make sense, because some people did not. So if they had Janssen, it's a one and done. So they're fully vaccinated. That's the difference. Partially means they either didn't get the second Moderna or Pfizer. So that's the difference between.
So are some partially vaccinated, they also in the individuals with at least one dose?
Yes, I would think. Or they just haven't gotten their second dose.
Okay, so that's,
It could be.
that's just, those two are confusing.
Yeah.
It is confusing, and I don't think that they're all very accurate.
I agree.
So let's just generalize, less than 50% of the population in Southwick is vaccinated.
Fully, yes, agreed. I still think that's good. Because a lot of people I've spoken to when I
but how much of the-
interview. Go ahead, Sue.
Go ahead, Kate. No, go ahead.
So I was just saying, over the I would say last 4 to 6 weeks, when I ask people that have tested positive, and I say, do you plan on being vaccinated? Most of them say no. So I'm not surprised that there's still that hesitancy. I'm not surprised at all.
All right. Anything else? Any other questions, Jean?
No,
We're in the yellow.
again, better than
We're in the
red.
yellow.
Well, we were green.
We were green. I can tell you that the past couple weeks, the cases are coming from Mother's Day and families. That's where I'm seeing the cases.
Yeah.
And neighborhoods, for sure.
Where
So
did
right
Tammy
now,
What
go?
happened?
We
to
lost
Tammy?
Tammy.
oh, Tam.
Yeah. Yeah, where'd you go?
She blipped us out here. No, she's gone. So I'm sorry. Did you have a question, Sue?
I answered it myself.
Oh,
I saw it on
okay.
the graph.
Oh, okay, good.
Yeah. She back? Trying.
Okay, everybody's still here.
Where did you go?
Yeah, we're waiting for you.
I wasn't sure if I lost everybody because I lost internet connection. And then I'm like, does that mean everybody gets kicked out of the meeting?
We can only hope.
Oh, no. That was really worrying me. I'm yelling at them downstairs. What are you doing? Okay.
Hey,
Sorry, guys.
Tammy, can you go over Governor Baker's new guidelines, when they start, what's going to happen?
That is exactly what I've got next on the agenda. Okay. So effective May 20, okay, we'll go back to May 18th. So on May 18th, the governor's order updated regulations for K through 12 activities and for youth sports activities. So for those, they basically anytime the kids are outside, they don't need to have a mask on. So that began so if you're talking about school or preschool, so that would be classes outdoors or recesses, that sort of thing. And then for sports, so that began on the 18th. So then we moved to May 29th. And on May 29th, pretty much while certain things will be rescinded, like the current mask order and the guidelines, that doesn't mean that there won't be other things put in their place. The mask order on May 29th is more likely going to be put to just being the CDC advisory, and then covering certain other more vulnerable populations like congregate care settings and in medical settings, that they'll still be required. On May 29th, the capacity restrictions will be removed. So everything pending public health data will go to 100% capacity limits. And at that point, the workplace standards will either be dissolved or replaced. But more than likely, it's looking like, from what we've been hearing, that they're going to be dissolved. Let's see. And then officially on June 15th, the state of emergency will be rescinded. So a lot of the things that we kind of were allowed to do, like requesting things like medical information, employers, you know, requesting that, so those things won't be allowed because we'll no longer be in a state of emergency. That's
Okay, Tammy, I'm sorry, just clarify. May 29th, I can walk into Big Y without a mask on.
more than likely.
Now, the caveat to that for the school children is the transportation, public and private, is still requiring masks.
Yes. Yeah, let me see if I have the list. Hold on, okay. So on 29th, okay, so in the schools, they will have to, for the rest of the school year, wear masks. In the bus settings, transportation settings, they'll have to wear masks. The other things that will still be in effect, public and private transportation, including ride shares, taxis, ferries, MBTA, commuter rail, transportation stations, healthcare facilities and providers, congregate care settings, and health and rehabilitative day services. So those will be the things that we definitely know after May 29th, we'll have some sort of regulation or guidance put upon them.
Okay.
Tammy.
Can't tell, everyone looks
Businesses can require masks if they want, can they not?
They can after that. Towns can make their own regulations. Businesses can have their own policies if they'd like. It doesn't seem like the governor is kind of promoting that sort of aspect, but it is something that the option is open to people. I am going to request signage, and I just feel like we should keep it up because the advisory states people who are vaccinated should be able to take off their mask when they're in public. I do want to continue putting up signs that state that on our town buildings because, as we've just noted, 34% of town is vaccinated. So there are a lot of people who aren't vaccinated that wouldn't really be covered by the CDC advisory. So I do want to continue to post that information to make people aware that, you know, if they are at risk and they are a risk to others.
The Nationals, you said that they were going to postpone them.
So, okay, so the Nationals, it is looking now like a July 10th date for that.
July.
Woo.
That's better.
There's a ghost in my room. My lamp is falling over.
Okay.
I feel like this is the day that all the technology is going mad.
And so, Tammy, July 10th, is that what you said? There won't be any restrictions for them then, will there be?
No, there wouldn't be. If everything goes the way that the governor says it's going on May 29th, those restrictions will be gone. And we'll be talking about an outdoor event. So they've already sent us sort of guidance for road races. Road races will have continue to have guidance because of the close proximity to people huffing and puffing, I guess. It's more sort of along the lines of staggered starts and not sharing water, at water stations and things like that. It's not a very extensive guidance, but at least it covers sort of those aspects. But it's not going to be like masks or anything like that. Just kind of smart practices while you're out there getting things done.
What about the workplace?
Let's see. So
what about the workplace? If you can't,
we don't know. We don't know anything about what's going to happen to workplaces yet.
Okay. Okay, go ahead. Sorry to interrupt.
No, my connection is now starting to get unstable too. So I think that everyone's going to say something and I stop. But so far we're making assumptions as to what's happening after May 29th, but we don't know anything definitive. They haven't posted anything that there will be workplace standards other than those things about the masks and whatnot. So we will find out more as we come. And now, like I said, they're not doing Friday updates, so I will only get updated on Tuesdays now. So one of the things that popped up the week before was the employer vaccination program. And the program allows employers to either book like a certain amount of vaccine appointments at a clinic, or allows people to get the mobile unit to come to them. So they also opened that up to schools to use now that 12 and 15 for the Pfizer has been opened up. So I did forward that on to the school department, and because there's some talk about maybe having making the option open, because there are a lot of seniors who are going to state colleges, and those kids are going to have to get vaccinated before they go back. I won't call them kids, but they're technically by that point probably adults. But it'd be great to have that option open, because if you looked at that list, it's still a low, the lower ages are still haven't really been represented very well. And I don't think that's just Southwick. I think that's pretty much everywhere that the younger community hasn't been vaccinated yet. But last week, CDC officially approved and FDA approved Pfizer for being used for 12 to 15. So now as of this week that you can make appointments and you can get the shot. My nephew just went. He was so proud to go. He went to the Whitney Avenue, Bay State on Whitney Avenue on Tuesday, and he was like through the moon that he was going. Like, I'm doing my part, and I thought that was fantastic. And he tried to get out.
What's going on at the Big E? Are we getting many people?
No,
Southwick?
it's slowed down quite a bit. We've gone down to walk-ins. We're trying to, Cindy Sullivan in the senior center, she has access, and we both have access to do the appointments online for Southwick residents, and the numbers have gone down significantly. I don't know if she's had anybody in the last week even who has gone to the clinic or signed up with us, because it is pretty easy. It's so open. You don't even at this point need to sign up. You can just go in, but they still are obligated to be open, I believe, until next month, the end of June. So mostly because they still have to do this, and it's Moderna,
I'm sorry,
so
Tammy,
it's a 4-week wait.
Go ahead.
Okay, I missed some of that. I had a bad internet connection. So the vaccines are available, readily available?
Yeah, you can walk in. Yep.
What are the hours at the Big E?
I believe it's 9 to 3 or 9:30 to 3:30. Yeah, and it's not great hours.
7 days a week?
No, Monday through Friday. But at my last,
9 to 3 is not good if someone works till 5.
I agree. Yeah.
8 to 5.
At my last health officers meeting or health coalition meeting, both the clinics in Chicopee, Chicopee, Holyoke, and in Palmer, we're seeing a decline. So most of them had gone to walk-ins, and there were some clinics like Wilbraham had access. Like they decided they just wanted to get rid of their doses because they weren't doing a lot of that business. But they've opened up a lot at pharmacies all over the place. That's readily accessible. There are some physicians who are now available to do it depending on where they work. So I think there are options, but now I think it's really just how do we get the message out to get people to continue to get it. And so right now, like I think I talked about the last meeting, the Hampden County Health Coalition is trying to work on how we hit the younger population. And so, you know, like trying to get people vaccinated before college and whatnot. Any ideas is always appreciated though, to figure it out. I mean, we're trying to make it easy on people there's the link on our website where you can just go straight to the Big E's website. So, and then the vaxfinder.com has been up there for months. So we'll see how that goes. Let's see. So, the day after our last meeting was the day that we went out and we did the homebound vaccinations. And that was amazing. It was such a fun day. Like, yeah, it was interesting to kind of get out and go into people's homes and talk to them and see how they've been faring through the pandemic. And a lot of the people, they haven't seen a lot of people other than their healthcare providers and whatnot in the last year. So it was really nice to go in. The paramedics that we were paired up with were fantastic. They were so good with the residents. Like we did have several that had dementia and were, you know, a little apprehensive at first, and they just handled them amazingly. And it went really smooth. I believe we did 28 residents. And then we did a Granville resident and a Tallinn resident. But they came up towards the border to the fire department in Granville. So we just popped over the border and went back. And their EMTs took care of them afterwards. It was amazing. And then the next week we did have some left. And so there were some residents who might not have been considered homebound, but really did have a hard time traveling. So they kind of met us up outside at the senior center where they had the tents up if you've been by. And we finished a couple, the rest of our doses off on that day. It didn't take very long at all. I think we had 9 people. And so we finished up, and that's that for vaccine, I guess, for now. We'll see. Maybe we'll find out more. Are we going to be doing what?
Are you getting more doses?
No.
Vaccines? No.
We're done. Yeah. No one else has called. We were like so certain that like on Monday after we did it, someone was going to call and say, I'm homebound and I need a vaccine. And like, no, but we didn't get it. We haven't had any other calls. They were kind of coming in pretty steady for a while, up until maybe even 2 days before we went out, we were still getting new people added to the list. So talking to other towns who've been doing it, we did way more than towns four times our size, actually. Yeah.
That's good.
So we
Do we have any doses left?
no,
No,
Yeah.
okay.
We
Good.
should.
they were all open, Kate. So they're gone.
Oh, they were opened. Yep.
We had to not defrost, but they had to go out to room temperature the day that we had the clinic. So
Okay. So
So
should
those
I,
are-
for MIIS, should I put that in our inventory?
oh, okay. I didn't realize that. Yeah.
Yeah, we have to be
Fine.
accountable for 50 doses. So if 16, right, you did 34, I think, 34, 16, I just have to put that in MIIS.
Okay. Yes, we had because we took them out to get them to room temperature. So they were
Okay.
They were
Yeah,
gone.
they can go back. Okay, gotcha. I'll do that tomorrow.
And we ended up opening up an extra vial the day that we were out somehow. So that's why we were short a vial after that day too. Because they were 5 doses per vial.
Gotcha.
I think that's it for my list of things. Just a few things.
Kate, you have anything?
No, I'm good. Thank you so much.
Jean,
No,
Mackenzie? Any questions,
I'm good.
anything?
Not as of right now, nope.
Okay, Peter, you had a question before.
Yeah, it
Did
was
he
really
answer
just more or less. Yeah, actually, I had another question that I just thought about while you guys were talking about the mask order. Last spring, didn't you guys vote your own mask order for Southwick itself days before Baker mandated for the rest of the state? Is that still technically in place for Southwick for now? I'm assuming that'd be something you'd get rid of.
From what I was told, it was superseded by, if anybody had put one in place, it was superseded by the governor's order.
Gotcha. So when the states is gone, it's gone for Southwick too.
And we can only do those anyway, as long as there's a state of emergency, I believe.
Okay, gotcha. Yeah, otherwise you answered my question earlier, more or less. So I'm all set. Thank you, guys.
Doug, do you have anything to add? Anything to ask?
I do not. Looks like you guys covered all of it.
Jessica,
I
you got
make-
it? Okay, go ahead.
I make a motion to adjourn the meeting.
Oh, wait a minute. Jessica, you all set?
Yes, I am all set. Thank you.
Okay. So wait a minute, the next meeting is June 3rd.
Hmm.
Right? Next Monday?
2 Mondays.
2 Mondays.
Yeah.
Monday?
you-
No, Thursday.
Thursday.
We
Yeah,
used-
It's
used
the
to-
third.
we used to
Yeah.
meet on Monday.
And we
Oh,
started
okay.
meeting on Thursday because I had to do something on Mondays.
Yeah. All
So
right,
we
so June,
changed it to Thursday. Yeah,
June 3rd is the first Thursday of June.
right.
Yes.
7
Okay,
o'clock.
okay,
go ahead.
now
Now make your motion.
I'll make a motion to adjourn the meeting at 8:13 PM.
Second, anyone?
I second that.
Okay. All in favor?
Ask for a roll call.
A roll call. Sue, yes.
Jean, yes.
Mackenzie, yes.
Okay.
Okay,